Welcome, everyone. We're all filtering into the room, and it is 12 o'clock noon here in Ohio, so we're going to go ahead and get started. We have a great session planned today, and it's called Youth Vaping Prevention Encore, Community Resources for Supply, Demand, and Risk Reduction. I'm Sarah Kondrak, and I have the pleasure of hosting the first Project Echo Hub dedicated solely to supporting the prevention behavioral health workforce. There are currently over 1,500 Echo Hubs in more than 200 countries, and we're really proud to use this global model here in Ohio to strengthen prevention practice. This Encore is a special opportunity to bring our community back together after our original 6-session Youth Vaping Prevention series, which wrapped up in March of this year. Over the course of that series, we explored the complex drivers of youth vaping and shared practical strategies for addressing it. Today, we're going to build on that foundation by focusing on how supply, demand, and risk reduction strategies intersect and how we can connect with community resources to make those strategies possible. So thank you all for being here to learn, share, and continue this work together. So this Echo Hub is facilitated by the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, and you can visit our website listed on this slide to learn more about the center's work. The center is funded by the Ohio Department of Mental Health and Addiction Services and administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation, or PIRE. So many of you attended our previous sessions, but if this is your first time at an Echo, welcome. We're so happy you're here. At the heart of Echo is the philosophy of all teach, all learn. Each session starts with a presentation from an expert on a topic, followed by a community member sharing their work and experiences. The reason Echo is so unique and effective is that everyone here brings their own knowledge and experience, and we get to learn from one another. A key benefit of Project Echo is that this model democratizes access to information and expertise. That means no matter your location or professional network, you have access to the latest best practices. Echo builds workforce capacity by empowering professionals across different sectors with the skills and knowledge they need to make an impact in their own communities. So some practical tips for today. Please mute your microphone when not speaking. And I understand it's lunchtime for many, but if possible, please turn on your cameras. These sessions are intended to build connection with our colleagues. I encourage you to use the chat as much as you'd like throughout the session, particularly if you'd like to share resources with your colleagues. We'll capture all of those and put them in the notes at the end of the session. Finally, please reach out to my wonderful colleague, Nancy Clough, if you are having any technology issues. So we have an incredible hub team that's responsible for ensuring that this series meets your needs. You can identify the hub members by the white background and Echo logo if you want to reach out. The hub team is committed to creating an inclusive environment by providing all necessary accommodations. We'll start and end on time and only record the session, that's the didactic presentation, and we really want to respect your privacy and the community members that you serve. We also ask our participants to help us create a safe and respectful learning environment by valuing the opinions of your colleagues, using inclusive language, and protecting the privacy of everyone involved by keeping these discussions confidential. We encourage you to be open in sharing your experiences, knowing that this is a supportive space. We are excited to share 2 additional Echo opportunities happening this month. We've got an Ohio Adult Allies Ready to Enhance session, which will be on digital citizenship and online safety. And that is this Friday from 10 a.m. to 11. And we've also got an encore session for our adult lower risk drinking series. As always, continuing education credits are available for all of our live Echo sessions, and more details and registration links can be found on the center's website. All right, and with that, I would like to introduce you to our didactic presenter, Dr. Bonnie Halpern-Felsher. Dr. Halpern-Felsher is the Marin and Mary Elizabeth Kendrick Professor in Pediatrics in the Division of Adolescent Medicine, Department of Pediatrics at Stanford University. Dr. Halpern Felsher is a developmental psychologist with additional training in adolescent and young adult health. She is the founder and executive director of her Stanford Reach Lab, as well as several national and internationally used drug education preventions and interventions. She is the recipient of the 2025 American Lung Association Outstanding Mother Award and the recipient of the 2025 Society for Research on Nicotine and Tobacco John Slade Award. She is also the immediate past president of the Society for Adolescent Health and Medicine. Funded by the NIH and many foundations, her research has focused on understanding and reducing adolescent and young adult tobacco, marijuana, and other drug use. Her research, including over 225 publications, committee, and advocacy work, have been instrumental in setting policy at the local, state, and national level. She served as a consultant to several community-based adolescent health promotion programs, participated in 3 Surgeon General reports, participated in 6 National Academies of Science committees, and has been a member on several national campaigns and committees to understand and reduce adolescent and young adult drug use, and just very well credentialed and experienced. So we're so excited to hear from Dr. Halpern Felsher. Welcome.
Thank you so much. And good morning, good afternoon to everybody who's here. Um, I'm going to go through this pretty quickly. It's only a 20-minute talk. But I will end with my email if you do have any questions or follow-ups, because this is a snippet of a larger talk that I often give. So let me go ahead. First, I do want to start with some disclosures. I don't think you'll be mad at me for these, but I am an expert scientist in some litigation against e-cigarette companies. You can figure out which ones. And I've been an expert in some city, state, and federal level policies. So we're going to talk today about how policy, regulation, and community action can reduce access to vaping products. So I'm going to start with kind of interspersing some of the issues around e-cigarette use, which I know you've had some talks on already. So I'm going to make it very much on some of the things that I'm concerned about that you can do something about and how. And then we'll end with some prevention strategies that can reduce the demand and risk by addressing root causes and promoting healthy alternatives. And during that time, I think Nancy or somebody's going to be popping a bunch of information into the chat. Please have your phones out too, because I do have some QR codes at the end. I also have a pop quiz that I like to do. All right, so the first thing I want to talk to you about are what we call on our website SIGs in an e-cig. And at the, there should be a QR code. It might not be showing up, but this image is also on our Reach Lab website. By the way, anything I talk about, it's completely free and completely online, and you'll see that website in a little bit. So everything that I talk about, I'm not selling you anything. All of our resources are free. But one of the things that I do want to talk about is the amount of nicotine that's in e-cigarettes, and you may not realize that. So first of all, you probably know that a pack of cigarettes has 20 cigarettes. What you may not know is that each cigarette has about 8 milligrams of nicotine, but what you actually inhale, the yield, what gets into your inhale into your lungs, bloodstream, and into your brain, which takes just a few seconds, by the way, is about 1 to 1.5 milligrams of nicotine per cigarette. So if you were to smoke an entire pack of cigarettes, you'd get 22 to 25-ish milligrams of nicotine. So what's happening with e-cigarettes is starting with Juul, and I know Juul's not used as much, but it is kind of where we anchor to a lot because people are familiar. A Juul pod, which is really little, has 59 milligrams per mil. Sorry, we're doing a little bit of math, then we'll do chemistry. 59 milligrams per mil. It's a 0.7 milliliters volume. 59 times 0.7 gives you 41, 41.3. Juul used to say, they took it off their website. Gee, I wonder why. But they used to say the majority of what's in our product you get into your body. Yay! So if you just simply do the math, if you were to inhale an entire pod of Juul, you'd get somewhere in the 41 milligrams of nicotine, about 37 cigarettes. Now, some people say a pack of cigarettes, some people say 2, some people say 1.5, somewhere in between, but a lot of nicotine. If you were to use Flume or Vuse, very popular ones, you're getting upwards of 300 cigarettes. And then Elf Bar, which keeps changing their name to Skirt Regulation, Lost Mary, 380, whatever they call themselves, Geek Bar, that is almost 600 cigarettes worth of nicotine. So young people are getting a huge amount of nicotine. Not only that, there is no nicotine standard in the US. There is no maximum amount of nicotine that you could put into these e-cigarettes. There are nicotine standards in other countries, like in the UK, for example, you are not allowed to have more than about a half a pack of cigarettes worth of nicotine, so about 1.5%. Here we can have 5%, 8%, no end. It's part of why young people are so addicted is the amount of nicotine. Let's get to the chemistry. Not only that, but it's the type of nicotine. The original cigarettes and cigarettes and the original e-cigarettes have a free-base nicotine. If you think litmus test, right, in chemistry, alkalinic or basic to the acidic side, the free-base nicotine is very basic. It's very caustic. I've never used these products in my life, but people talk to me, and if you're a past smoker, maybe a current smoker, no judgment, people talk about that throat hit and how caustic it is on your back of your throat. Well, if you're a user of these products, it's going to be very caustic, and you're not going to like it. Juul in 2015 patented a salt-based nicotine. What it did is it added salt or acid in the form of benzoic acid, which moved the needle from very caustic to now more acidic, but really neutral. So now you've got a very high nicotine level that's a very strong and more potent and very smooth and tasty, which we'll talk about, form of e-cigarettes. And it's why we're seeing so many people who are addicted. So a nicotine standard alert. What we're talking about with this hookah, the same thing. There's no high standard. I don't actually know exactly how much nicotine is in a hookah. I'll find out. That's a good question. And I think it depends on how much nicotine you put in, how much of the flower, the leaves you put in. But one of the areas for advocacy, and I'm going to have these alerts throughout, is nicotine standards. And in fact, right now, and during the time when Tracy, you're talking, I'll look it up. There is the opportunity to put in a letter to the FDA, to the government, to advocate for lowering the amount of nicotine that can be in these products. That's one area. All right, second and third hand smoke. You may not realize this, but that plume of aerosol, it's not a vapor, by the way, it's an aerosol that comes out of these cigarettes, has chemicals in it that are harmful. So we know that it has nicotine, has heavy metals, has ultra fine particles, has cancerous chemicals, and has volatile organic chemicals. All of these are very harmful. If you're standing next to somebody who's vaping, these come in to your lungs as well. More and more research is showing that. But that plume of aerosol doesn't just dissipate, it has to go somewhere. So it falls to the ground, mixes with the chemicals that's in there, and forms toxicity that leaches off for years. We know this with cigarettes, and we're starting to see with e-cigarettes as well. So when I talk to young people, I really talk to them about, do you really want your baby sibling or your pet to be eating or licking off the floor, the windows, your drapes, whatever, and getting that toxicity as well? And it's a social justice issue. We know that tobacco smoke and the aerosol goes from building to building and walls to walls. So it's really important that we protect those around us as well. So a policy alert here is, depending on where you live, if you do not have comprehensive, inclusive indoor smoke-free air laws, advocate for them. They should include cigarettes, e-cigarettes, and by the way, cannabis vaping and smoking as well. So why do youth use? So there are a lot of reasons, and again, in 20 minutes, I don't have time to go through these in depth. Happy to talk offline if you want the longer version. But I want to talk about a few things that are important to know and that have community and advocacy opportunities. Flavors. So we know, oh, this is cannabis. Sorry, it's the same thing for vaping too. But if it smells good, tastes good, it probably is healthier. And that's how young people feel. Well, it doesn't taste like tobacco, so it must be okay. We know that young people are using vapes, they're using e-cigarettes, and that's with nicotine or cannabis because it smells good and tastes good. This has been a problem, and we know, and if you, I'll tell you the answer. We don't have time for the pop quiz on this one, but that there are lots and lots and lots of flavors of e-cigarettes. And it used to be that the e-cigarette companies would say, and they still do, oh, these are for adults, so that way adults can quit smoking cigarettes. Well, first of all, there's not great evidence that e-cigarettes help adults quit smoking cigarettes at a population level. There are some studies, very controlled, give you lots of attention and love, but to the average consumer, it does not help you quit. And not only that, but we don't need flavors to help adults quit. Adults don't need honey doo doo, sugar booger, unicorn poop, honey doo doo to help them quit smoking cigarettes. These are squarely for our kids. So one of the things to advocate for is a flavor ban. So that's me at the top. This was in August of 2020 on my birthday. It got signed into law. I advocated, I testified for a flavor ban in California. Um, you have to watch for enforcement. That was one of the big issues that we had. We're still seeing cracks in this enforcement, but it's effective. We're seeing good effects on it. So one of the things that I would say, and I would be happy to help you, I can give you all my testimony and all my data. Let's get flavor bans. We're not going to get at the federal level. Let's get at the city, county, and state level. And they should be inclusive to include menthol and to include loopholes. Watch out for loopholes. In California, right after the flavor ban went into effect, the cigarettes came out with non-menthol cigarettes that were green and smelled and taste like menthol. So we really need to close loops on that. Easy to hide. I'll just give you 10 seconds to see if you can pick out the e-cigarettes here. Here they are. This is not by accident. I'm going to show you a lot more pictures on this. E-cigarettes look like household products. They look like USBs. They look like highlighters. I'm going to show you even more awful pictures. They look like pens. They look like everything. So if you're a parent or a healthcare provider or any of you out there, educators, it's really hard to tell if something is an e-cigarette. And this is to allow young people, excuse me, young people to be able to hide their products. We also see marketing, things like this. These are e-cigarette juices, the nicotine juices that look like juice boxes. This is not attracting me as a middle-aged woman, although my kids keep reminding me, my adult kids, that I'm more than middle-aged. But as a middle-aged woman, this is not attracting me. This is attracting young people. And then my not favorite, highlights. This is a vaping device, but it works like a highlighter, and then you can inhale it as well. You can have things like this that look like Happy Meals, and you vape from that little tip. And the FDA has been putting out warnings to these companies, but right now, as you probably know, the FDA's Center for Tobacco Products is basically gutted. There's not a lot of tobacco enforcement or control going on. We also have, if you want, you could vape your Minions. You could vape your Gloomy Bears. You can vape Bobo style. And there are flavors and styles that look like vape. Sorry, I see a lot of things in the chat. Just given I'm going fast, I'll look at it after and can chat back some thoughts. And then my really not favorite, and these games, this is fairly new. There are now e-cigarette video games, and you win points and stuff by vaping at the tip there. And the latest one is a Tamagotchi, and if you don't keep vaping, your Tamagotchi character dies. Again, this is not attracting us adults. This is attracting our kids. So we need to really eliminate and work hard to get rid of youth-focused marketing and youth-focused products. This has been really hard, but we could do it. Now, unfortunately, a lot of the products are coming from overseas. They're being imported. Most of the e-cigarettes on the market today are illegal, but we need to keep going on this as we can. All right. Access. All right, this pop quiz, everybody should participate. We've got plenty of time for this. All right. What is the legal sales, the minimum legal age, MLA, minimum legal age to purchase e-cigarettes and cigarettes in the US? And if you want to throw in cannabis, great. Everybody needs to know this. All right. Most of you got it. All right. Beautiful. Most of you got it. All right. Awesome. It is 21. This is important. Most of you knew it, but many, many, many talks I give, people don't. And we actually published one study, and we're about to publish another showing that about half of the US does not know this, particularly teens and young adults and parent age people. So we need to talk about this. That's why when I see signs like this that say student discount, it really angers me. The majority of students are under 21. We graduate college at 22. Now, many of us on this Echo have gone on for further education, but the average person finishes college at 22. When it says student discounts, this is squarely attracting people under 21. So we need to be vigilant. So your advocacy alert here, and we have information and flyers on our website to talk about Tobacco 21, and we're building more. Get the word out and help enforce, help make sure that we're catching the retailers who are selling to those who are under 21. And then finally, stress, and then I'll quickly end on some more resources. Youth are so stressed out right now. We're all stressed out right now. More and more studies are showing them. And we know that when young people, this is one of our papers, when youth are stressed out, they're more likely to use tobacco, cannabis, and both products. We know that this is the case. Young people adults self-medicate. Young people self-medicate a lot with e-cigarettes to feel better, or at least they think they're feeling better. What they're really feeling is not bad. And plenty of studies, these are from SAMHSA, Substance Abuse and Mental Health Service Administration, and the CDC, that youth 12 to 17 who have had a major depressive order or episode are so much more likely to use any form of drugs, including e-cigarettes and other nicotine products, than those who have not had a major depressive episode. And we know ACEs, adverse childhood events, that we're seeing right now about 75% of young people, adolescents, have experienced at least one ACE. Nearly 1 in 5 have experienced more than 4. And we know through numerous studies here, again, these are from the feds, that if you have experienced an ACE of any sort, you're more likely to use drugs as well as engage in other risk behaviors. We need to talk to young people about healthy options for coping with their stress. Now, I'm not saying sleep and it just takes care of the fact that your parents got divorced or that you're worried about a college or economy. No, I don't mean it that literally. But the fact that, and Tracy would probably say even more or knows more about this as somebody who does a lot of behavioral health, but we know that we can help young people deal with stress a lot more. And we've actually built some curriculum around this. The other thing is we cannot blame or shame young people or adults who are going through mental health issues, substance use, or the combination. No blame and shame, no stigmatizing, no stereotyping, no discrimination. We really need to. So this is kind of a catch-all advocacy alert. Be aware of mental health, screen for mental health. Let's talk to young people, meet them where they're at because they're really struggling. All right, so summary, and then about 3 minutes left or so on some resources. We have a perfect storm to addict young people. We have stealth, youth-focused products that have very high nicotine and THC, very high. Young people don't understand these products. You probably don't, nobody understands them fully and all the health risks. They come in flavors and packaging and ads that attract our young people, but they are harmful. So what can we do? At the Reach Lab, we talk about normalizing drug education communication and to realize that you can normalize drug education without normalizing drug use. We talk about it as having a conversation, not a confrontation, not a lecture. So it's important that I have a colleague who used to say, yeah, on June 10th, I'm going to sit down and schedule a conversation with my kids. No, my kids who are 25 and 29 said I was the queen of organic conversation. Like I'd find an opportunity to raise a conversation with them, have it come out organically. Your education has to be based in science, not hyperbole, not scare tactics, science, and based in how teens learn, not us adults, right? You tell me I could shave a year off my life, 5 years off my life, I'm going to cough, I'm going to have wrinkles, whatever it might be. I'm not doing it. That's not true for a teen. They want to look cool, they want to be with their friends. So we need to come from the perspective that they're coming from. And most important is we need to keep teens safe. So drug education should be based on how they learn, keeping them safe by empowering them based on the facts and meeting students where they're at. And what I mean by meeting students where they're at is a continuum of use. I'm talking about making sure that making sure that you understand where any individual or group is. In any given group, you could have some who've never used all the way to a lot of use and substance use disorders. So going into a group and addressing that entire spectrum without calling a young person out. So your first QR code, and Nancy or somebody I think is going to start throwing a bunch, throw them all into the chat because I got a minute left, so I'm going to fly through this. This is our Reach Lab website. Excuse my face all over it. I hate that. But we are a one-stop shop. We have free preventions, interventions, curriculums, resources, and so on. Another QR code for you. We have our tobacco prevention toolkit, which just hit 9 years in the making. We have our flagship You and Me Together Vape Free. This is for elementary, middle, and high school students. We have Smart Talk for cannabis. We have Safety First, which is all drugs. And then we do have an alternative to suspension cessation program called Healthy First. We need to have comprehensive drug education. We need alternative to suspension programs. Sending a kid home and suspending them, which some of you may be doing, not judging, but it does not help the kid. They're stressed, they're addicted, they're bombarded with ads. We need to work with them and help them. So we've got those programs for you. So sign up for our newsletter. And any questions you have, I'll pop some of this into the chat. There's my email. I'll throw that into the chat. And I did it 20 minutes and a few seconds. Thank you all. And I'll look at the chat for any questions I can answer.